Pesticides have numerous beneficial effects. These include crop protection, preservation of food and materials, and prevention of vector-borne diseases. However, pesticides can be harmful to human health too. For this report, studies were conducted on the environment and households practicing farming in Wakiso district.
And there we tried to understand how do smallholder farmers apply pesticides. And this practice that we have observed, we wanted to understand how does this affect the health of the farmers, but also how does this practice then lead to pollution with pesticides of the environment. In addition, we had a research component that also studied how do legal texts in Uganda actually regulate pesticide use at the level of the farmers, but also at the level of all others involved in pesticide selling, marketing, and so forth.
Several blood, urine and water source samples from the district were tested to establish if they contained pesticides.
Our research looked into two distinct groups, all farmers, but one using the traditional organic practice and one using the conventional pesticides to fight different plant diseases mainly. We analyzed 100 urine samples of the farmers and looked at what kind of pesticides are present. And in all the samples we could see several pesticides present. We could also see that if the farmer reported to have used this specific pesticide, there were increasing levels, in some cases very high levels present. In addition, we could also see that the level of pesticides in people who did not use these pesticides were also high. And this can have several factors. So you can also think about contaminated food, for example, also contaminated water. And also people using these pesticides at home or for the livestock.
Pesticides are toxic, and by design they are biocides designed to kill, reduce or repel insects, weeds, rodents or other organisms that can threaten public health and the economy. Their mode of action is by targeting systems or enzymes in the pests which may be identical or very similar to systems or enzymes in human beings, and therefore they pose risks to human health and the environment. And this is why this report should concern the general public.
There is certain more indirect exposure pathways like contaminated food, contaminated water, or using these chemicals in the house.
This problem was found to be largely dependent on the behavior of farmers.
Predominantly, most of the farmers were simply using gumboots. They put on their ordinary clothing. There was minimal protection, let's say, of the mouth or the nose, especially when they are opening or trying to mix these chemicals, which really could be a risk since they may inhale in these chemicals when most of them look at these chemicals as the first line of defense, anything, since these chemicals are readily available in the local shops in the community. So instead of a farmer going what they may call the harder way of taking care of the crop or the organic practices or the much more ecologically acceptable practices, since these products are almost everywhere, a farmer finds it easy to walk in a shop and buy these chemicals. So we see there's that easy access to the chemicals that most farmers are entirely relying on these chemicals.
Effects of pesticides on human health are evaluated by experimental and clinical evidence of toxicity and epidemiological evidence of short and long-term effects. Dr. Vincent Karuhanga, a physician at Friends Polyclinic, explains.
One can get cancers. Cancers of the breasts and the other cancers have come up because of these pesticides. Cancers of the lungs because of the sprayable pesticides reaching our lungs through breath have also been reported. Cancer of the skin, it has also happened to many people who have worked in areas where they use pesticides. Unfortunately, this will happen after a long time. People have had what we call endocrine disruption. These pesticides can affect our systems which make hormones or hormonal systems For example, people may end up with problems of the thyroid gland. Some people may end up with fertility issues. Some of them may have early puberty. One can have brain damage, Parkinsonism.
The emphasis is now placed on the need to balance alarm about the hazards of pesticides with a sound understanding of precise risks and the best ways to prevent them.
Can there be awareness raising programs to teach the farmers out there, but also the general public, on the responsible use of these chemicals?
There is need for an urgent strategic approach for a reduction in the use of agrochemicals for the implementation of sustainable practices. Furthermore, current agriculture has to implement environmentally friendlier practices that pose fewer public health risks. Reforming agricultural practices aligned to fulfill these criteria is a step toward the sustainability of the agriculture sector in contrast to precision agriculture. Walter Mwesije, NTV.